Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Kim Rich, and Carlos Saraceda is interpreting the meeting in Spanish. His interpretation will be available on the county's website and YouTube page shortly after we conclude this press conference. The very hard work of Dr. Dorenoso and Dr. Anzorg over this past weekend, through many conversations with both the Governor's Office and the California Department of Public Health, has produced significant progress. The county's Public Health Department staff used the issues raised in the unanimous letter sent last week by the Board of Supervisors to the Governor to negotiate with the state to provide greater flexibility to reopen more businesses in our county. Today, Governor Newsom announced that there will be a modified state attestation process that Santa Barbara County can submit beginning tomorrow. The California Department of Public Health recognizes the unique circumstances posed by the Lompoc Federal Prison in our jurisdiction. The virus outbreak within the prison will not be counted against our county attestation criteria. The Board of Supervisors will meet Tuesday morning and consider an ex-agenda item that could allow the county to submit documentation to the state to begin the accelerated business reopening process. It is not clear at this time when final authorization by the state will be completed. Not all businesses will be able to open. Only the businesses the governor has indicated in phase 2 of his 4-phased reopening process. For more details on the specific businesses, please visit the governor's COVID-19 website at covid19.ca.gov. That's COVID19.ca.gov. In other good news, we have opened new lines of communication with the Bureau of Prison officials regarding the virus outbreak at the Lompoc Federal Penitentiary. The county welcomes the opportunity to collaborate with the Bureau of Prisons to ensure both agencies are working together to protect the public health and safety of local residents and inmates at the prison. Crowds at local beaches were manageable this past weekend. Beachgoers were being safe and practicing physical distancing. Parking issues in the neighborhoods near beaches was more manageable than previous weekends. This is good news heading into the Memorial Day weekend. I want to strongly encourage anyone who would like to be tested for COVID-19 to please set up an appointment right away. There are many testing slots available at each of the 3 locations in Santa Maria, Lompoc, and Santa Barbara. Testing is fast and easy. The locations are convenient and accessible. In Santa Maria, the location is the Santa Maria Fair Park. The testing site in Lompoc is the Anderson Recreation Center, and the location in Santa Barbara is the Earl Warren Showgrounds. Please call 888-634-1123 or go online to set up an appointment. Significant expansion of COVID-19 testing is critically important to the county public health department's ability to manage the virus. You no longer need to be experiencing symptoms or meet any of the original screening criteria to get tested now. Anyone who wants to get tested can now get an appointment. The turnaround on receiving test results has improved, and we are hopeful this progress will continue and results will be available quickly. Today, I'd like to highlight the incredible work of the Community Action Commission in responding to COVID-19. From providing seniors with nutritious meals to supporting youth while learning from home, the Community Action Commission has been providing many services for community members in need during this challenging time. This past week, the Community Action Commission partnered with local businesses and organizations to assemble care packages for seniors. These care packages were dropped off with prepared meals to seniors in need throughout the county. The packages included hand sanitizer, face masks, toilet paper, and other items that have been in short supply during the pandemic. Since the start of COVID-19, we have emphasized the importance of our community coming together to support those in need. This effort demonstrates how well our community members and community organizations are working together during this time of emergency. Many thanks to the Community Action Commission for leading this effort. I'd now like to introduce Dr. Henning Anzorg, the county's public health officer.
Thank you, Supervisor Hart. Good afternoon, everyone. We are reporting 22 new cases of COVID-19 today. 7 are from the federal prison and 15 are community cases. This brings our total in Santa Barbara County to 1,496 total. 27 community cases are hospitalized, with 11 of them in the ICU. 426 have fully recovered. Our hospitalization and ICU levels remain stable across the county. I'm proud to say that our hospitals are taking part in new experimental treatment options for severe COVID cases, and last week we were fortunate to receive a first allotment of the new drug remdesivir from the State Public Health Department that went directly to Lompoc and Marion hospitals for treatment. Today, we have received an additional 126 vials for use in our hospitals. All of our hospitals continue to operate below their capacity and have the ability to respond to a surge in cases if needed. Fortunately, our senior living facilities have been spared by large outbreaks, and we are working closely with these institutions to prevent this from happening in the first place. I would like to commend the community for their responsible actions and support in preventing further spread of the virus in our area. By now, we have performed large numbers of tests in our 3 testing sites. This shows that only about 1% to 2% of the population has been in contact with the virus. What this means is that most of us are still acutely susceptible to the infection. While driving along Cabrillo Boulevard on Sunday afternoon, I was amazed about the high traffic volume. When strolling along the beach, however, I was reassured that beachgoers were distancing very appropriately while enjoying the warm weather. Even though, while very tempting, I would like to remind everyone that it is safest to avoid leisure travel at this time. The more mobility of people, the higher the likelihood of viral spread. As welcoming as we typically are to our out-of-county guests, now is not the time for visitors. Hotels are only open for essential business and not for leisure travel at this time. We are all eagerly awaiting the next phase in our reopening plan. Once this has been approved by the state, we will have retail shops and restaurants open, providing they can conform with modifications that will inhibit spreading of the virus. The timing and movement through these phases will be determined by our infection and hospitalization rates. If those go up, we will have to become more restrictive. If these remain stable, we will be able to allow for more business to open. The county is in communication with schools and organizations to plan for child care and summer activities that can open safely with appropriate modifications in place. Again, I want to emphasize that our current stability is a direct result of our community's ability to keep new infections at a low level through physical distancing, wearing of face coverings when in stores or indoors, avoiding gatherings with people that live outside our homes, and excellent general hygiene measures. In summary, I'm very reassured about our relative case stability due to our community's cooperation. Thank you for that.
Thank you, Dr. Anderson, for the good news. Nancy Anderson, the Assistant County Executive Officer who managed the development of the county's Reopening in a Safe Environment Guide, is here today to tell us more about the RISE Guide. Nancy did a truly exceptional job in developing the county's business reopening plan. It was developed by the hard work of hundreds of medical, education, business, and industry leaders in less than half the time that was originally planned. Thank you, Nancy, thank you so much for your great work.
Thank you, Supervisor Hart. On behalf of the Public Health Department, the county published the Reopening in Safe Environment Guide, or RISE Guide, on Friday. The guide is essentially a Santa Barbara County playbook for reopening. It is a local supplemental guide to the state's 4-stage resilience roadmap. It describes when the county may begin to reopen institutions and businesses safely while prioritizing public health and upon approval by the state. It is important to note that the state is the authority dictating what industries fall under each of these stages. It provides how to limit the spread of COVID-19 and establishes tools and approaches to minimize future outbreaks once restrictions are loosened or lifted. And it offers what decision points to identify how phased transitions occur and the local criteria that might inform decisions to loosen or tighten. The guide is a living document comprised of 3 components: a core framework, industry sector guidelines, and a readiness and containment plan. The process to develop the guide was a marathon of meetings over the past 3 weeks. A project team was organized, and we engaged REACH to facilitate stakeholder outreach. We established an independent medical and public health expert panel. Dr. Lynn Fitzgibbons is here today and will provide some insight on the panel's work. We identified key stakeholder leaders to coordinate community and industry informal roundtable discussions. Then numerous panel meetings and roundtables ensued. In the middle of this, we had to incorporate the state's acceleration through stage 2 and add reference to state industry guidance that was published for many sectors. Public feedback from stakeholders was compiled and the document developed. And finally, the guide was presented to the public health officer for approval. We would like to thank the expert panel, Dr. Melissa Smith, Dr. Therese Ritter, Dr. Lynn Fitzgibbons, Dr. Kevin Ferguson, and Paige Batson, the Public Health Deputy Director, for their time and professional expertise. We would also like to sincerely thank the stakeholders, our economic cornerstone, for their time and efforts. There were 27 roundtables with over 350 participants. The roundtables included 10 cities and community service districts, 14 business and industry sectors, 1 thought leaders group, and 2 community-based and labor organization groups. The second component of the guide provides the industry sector guidelines. We knew that it was critical to partner with our industries to reopen as efficiently and safely as possible. REACH was engaged to help facilitate discussions and compile the feedback. We did have to pivot a bit in the middle of our discussions to incorporate state-published industry guidelines for stage 2 industries, but the industry guidelines also provide local guidance for industries in stage 3 and 4, not yet available from the state. The third and final section of the guide is the readiness and containment plan. The plan is critical in showing the state that Santa Barbara is prepared and ready to accelerate through reopening. This details how the county plans to consider the following: testing, contact tracing, protecting the vulnerable, acute care surge, essential workers, community engagement, and relationship to surrounding counties. The ride guides will be presented to the Board of Supervisors tomorrow at 9 a.m., which can be viewed remotely at www.countyofsb.org. Additionally, the guideline is available and feedback can be submitted online at readysbc.org website. Thank you.
Thank you, Ms. Anderson. And thank you again. The collaboration and the creativity and the determination that went into this work, I think, is probably the most important result. It's going to serve us well going through this crisis ahead. Dr. Lynn Fitzgibbons, Cottage Hospital's infectious disease specialist, is also here to share the collaborative work the medical and public health expert panel contributed to the RISE Guide. Dr. Fitzgibbons?
Thank you, Supervisor Hart, and thank you, Nancy. As Nancy explained, this RISE Guide, I think, is an exciting change in this entire epidemic in our local community. Up until now, we've really been very fortunate with the guidance of our local public health officials in telling us what not to do to preserve the health of our community. The exciting news that I think the RISE Guide brings us is a partnership with, as Nancy explained, literally hundreds of stakeholders around our community, really telling us in a Santa Barbara way what to do to open safely in a way that can support Dr. Ansorg in the weeks and months ahead. I was, as she said, very pleased to serve on this public health and medical expert panel, the RISE Guide. This was designed as a framework for really how to safely reopen our local economy and our communities. I was joined on the expert panel, as Nancy explained, by Dr. Therese Ritter, Dr. Kevin Ferguson, Deputy Director Paige Batson, and our chair, Dr. Melissa Smith. It was through a collaborative process that we analyzed criteria for moving between stages of reopening and reviewed key indicators for loosening as well as potentially tightening restrictions. These criteria were examined with very close attention to the most recent versions of our state and federal guidelines. The RISE Guide includes industry sector guidelines developed to really standardize industry practice in reopening, which maintains safety, prevent the spread of infection, and aim to provide confidence for employees, but also, of course, for customers to enter the workplace and to resume our community activity. Accompanying the development of this reopening plan is the critical need for a robust containment plan, which contains anticipated need in areas such as testing, tracing, treatment, healthcare capacity, PPE supplies, community engagement, and many of our Santa Barbara unique factors. These guidelines will continue to evolve with more guidance from the state and with refinement of best practice recommendations, ultimately steering, we hope, a safe and responsible opening process for our communities. It's important to note that the loosening of restrictions should be viewed as temporary. Even after restrictions are loosened, they could need to be retightened to varying degrees if the situation warrants based on our local data. Our local COVID data will continue to be monitored carefully by Dr. Ansorg and his team for signs of regression or worsening, in which case restrictions may need to be reinstated to assure the safety of our community. The local data of most importance includes new infections, hospital admissions, deaths, and system capacity. The loosening of restrictions will be phased in gradually, again steering us towards a safe opening process. In closing with a gratitude, I am so very, very grateful as an infectious disease physician for the leadership of Dr. Ansorg and his team at the Public Health Department. And I'm also grateful that I've been part of this expert panel involved with the RISE Guide, and we hope that, again, it serves its good purpose. The collaborative process with participation by the panelists, our stakeholders, all hundreds of them, and our amazing public health officials has served a critical role with informing the needs of our county going forward as we navigate this process of a safe reopening of Santa Barbara. Thanks.
Thank you, Dr. Fitzgibbons. We're all really proud of the strong partnership between Cottage Hospital and the County of Santa Barbara. Thank you.
Thank you.
We'll now go to questions from the room. Ms. Lair.
Thank you so much. Dr. Ansorg, you mentioned remdesivir that went to the other two hospitals. When does Cottage get it? And could either of you doctors let us know when the medicine is actually given to the patient? Because at some point they were talking about how it might not be working if you give it too late.
Yeah, I think Dr. Fitzgibbons can answer to that better than me.
Thank you. So I'm very fortunate that I wear several hats in Santa Barbara, and one is I actually do collaborate very closely and work with the Public Health Department. Dr. Ansorg and I have worked closely, as well as with Nick Clay over the last few days, to really fairly, ethically allocate the remdesivir shipments as they've come through. When the very first 10 doses, not 10 courses, 10 doses of this medication that requires 6 doses for even the most minimal treatment course. When the first 10 doses came through late last week, Dr. Ansorg, myself, representatives from Marion Medical Center and from Lompoc Valley Medical Center reviewed the current census of the patients within our county where there were the most cases, but also perhaps the most need. It was most appropriate that the two hospitals with the highest number of cases and the most acute cases on Friday received those shipments. And I really appreciate and respect the health department for putting the medication where it needed to go last week. The exciting news I think I can reveal right now is that a big shipment that Dr. Ansorg mentioned this afternoon is actually already en route to Cottage Hospital. And a patient has already been identified that could potentially benefit from this treatment. So I think an exciting opportunity with this medication, with now all 3 hospitals in our community receiving I think a fairly large allocation later today. And I think patients at all 3 of the facilities in our county who are caring for the sickest of the sick, now with this medication in hand, another tool in the tool belt to fight this illness.
And lastly, there was a State Street demonstration over the weekend, a reopening where people were shaking hands and not wearing masks. And yet there was another protest outside the prisons where they were wearing masks and they said they would self-isolate for 2 weeks. I'm wondering what you're imagining for this holiday weekend coming up. If you have any of you have any things you would say to those folks, because we could find out maybe in 2 weeks if any of those demonstrations might lead to more cases.
I guess I would just say that people have a right to express their point of view strongly and fervently. That's one of the pillars of our democracy. There are many ways to do that safely, and then there are ways that are not as judicious and wise. And we would encourage people to be smart and careful. The recommendations about being 6 feet away from each other and wearing masks are given to the public for a reason. And they are the core of why we are in a position now to begin reopening businesses. And it would be ironic and a shame if the activities of some people who are not thinking ahead would jeopardize the opportunity to accomplish the goal that they're trying to achieve.
Would any of the doctors want to add to that?
Well, as a doctor, I know that even patients don't necessarily listen to my advice. So that's just a given. So, I don't expect that. I'm actually grateful for the enormous response of the community in general. So I think these protesters that behave that way are clearly in the minority and do not really represent the majority of our county.
Is there any extra enforcement that you guys are calling in for this weekend, for Memorial Day weekend? Because even this weekend there was a lot of people out from LA. So I'm just curious if there's gonna be more sheriffs out there, or if there's any sort of parking enforcement extra or whatever it may be.
Tomorrow at the Board of Supervisors meeting, the board is considering an urgency ordinance that would allow for restriction of parking for time limits in response to some of the overspill parking that's occurred in some of the neighborhoods near the beaches. And that'll provide just another tool that'll enable law enforcement to better manage the situation. They're going to be careful and judicious with that. It's not a matter of restricting access to the beach. It's more a matter of putting the cars in the more appropriate places where they ought to be. And there will be law enforcement out at the beaches like there has been in the previous weekends, and lifeguards and park rangers, and everybody is on deck to encourage and educate and get the right kind of behavior from folks. And as Dr. Answork mentioned, things have been going really well. People understand what's at stake and are doing the right thing.
My second question is about contact tracing. Have you guys been able to, in any of the cases in the last week or so, have you been able to identify where they got it from, how they got it, or anything along those lines? And have you been able to isolate anyone that has been in contact with them?
Dr. Answork, do you want to handle it?
Oh yes, every single case gets interviewed immediately, and all contacts get identified and instructed to self-isolate and quarantine for 14 days. That is standard procedure. And we have a large team now because we expected more cases with our expanded testing, which fortunately hasn't happened. So we had 15 new cases today in the community, and all of those cases have been identified by our team and are instructed and getting treatment if needed.
We'll now go to questions on the phone.
Yes. First up, Tom Bolton with Newshawk.
I was curious, looking at the figures from today and over the last week, the city of Santa Maria has accounted for roughly 50 cases in the past week. And I'm wondering if you have a sense, probably for Dr. Answork, of why is that? Why are we seeing so many more cases there? And I'm assuming the hospitalization in that area is also equally high.
Yeah, we haven't been able to really identify the reasons why there are slightly more cases in Santa Maria area. The hospital census is slightly higher than Cottage, but if you look at the heat map of Santa Maria, we call that a heat map where the cases are, it's spread all over. There's not you cannot identify a single neighborhood or ethnicity or anything. It's all across the board, and it stumps me, honestly. And we basically just have to deal with it, and we were trying to reach out more, increase testing, availability, and education, and we're doing the best we can to sort of get it under control more. But you're exactly right, there's just a higher number of cases in Santa Maria than here.
So are you seeing any commonality there in terms of occupation or racial or ethnic group or
No,
anything?
we don't.
So you're not seeing anything that you can kind of pinpoint it to?
Yeah, exactly. That's why we are so stumped. We do not. It's like we check for everything, like occupation, annual income, native language, everything, and we just can't figure out what it is. It is literally all over the area.
Okay, thank you very much.
Thank you, Tom.
Next up, Reza with San Ynez Valley Star.
Hi, happy Monday, everyone. This question is regarding the remdesivir, and since giving it to the patients in Lompoc and Santa Maria this past weekend, have you noticed any significant change in their outcome?
So the challenge with remdesivir is that the improvements, if they're there, are subtle. With only a few days since the first patient started receiving this medication, I think it is unfortunately far too early to tell. Remember that the remdesivir data has been challenging thus far. We really only have the prelim data from Dr. Fauci's group, the NIAID, which showed us a 4-day improvement in symptoms and possibly an improvement in mortality, although that didn't quite reach statistical significance. What does this mean? It means you have to look at big populations of people to really see a substantial benefit with remdesivir. At this point, we have almost nothing else, and so this is an exciting option. It may well help some people, and we are absolutely emphasizing it, using it for everyone who we can, who would qualify. But I think it's going to be probably weeks, if not months, before we have a better sense as to what impact it's really having on our own patients.
And following that question about various treatments, have you started upping the doses of vitamin C to these patients as well? Or looking if there's any correlation? I've read articles that have stated in other areas that vitamin C has been very beneficial.
Thanks. Yes, great question. Vitamin C is one of several proposed opportunities for therapeutics. The data on it is again, not absolutely clear, but there are some groups, I don't believe anyone in the Santa Barbara area yet doing it, to my knowledge, but some who have proposed some benefit. And I think it's yet another area of potential therapeutic benefit, but we don't yet have that data.
Okay, one last question, sorry. San Luis Obispo County is going to be allowing their hotels to be open 50% capacity as of this weekend. And I wanted to know, looking at their numbers, their population, their total population is about half the size of Santa Barbara County, and their caseload is about half the size of what we have here in Santa Barbara as well. I'm wondering if the Board of Supervisors is considering opening up hotels like San Luis Obispo.
We're following the governor's phased reopening plan, and hotels are not in phase 2, and so they will not be open in Santa Barbara County beyond what the governor is providing a path to do.
Thank you for the question, Reza. Those are all the questions we have.
All right, well, thank you. As we begin this new phase of business reopening, it's more important than ever to follow the 3 simple steps each of us must continue to do every day to protect each other. Number 1, please stay home as much as possible. Remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands very often and for at least 20 seconds. Don't touch your face and disinfect surfaces regularly. Number 3, if you feel sick, if you feel any of the COVID-19 symptoms at all, don't go out. Isolate yourself at home. After a couple symptom-free days, you can safely resume your daily activities. If your symptoms worsen, please call your doctor or clinic and follow their medical advice. Tomorrow, the Board of Supervisors will again hear a presentation on the county's COVID-19 response. The meeting begins at 9 a.m. and is broadcast on Channel 20. A recording of the meeting is also available on the county's webpage. Our next press conference will be held Wednesday at 4:30 p.m. If you have any questions about what we talked about today, please call the county's call center line at 833-688-5551. And again, if you would like to be tested for COVID-19, please call 888-634-1123. These numbers will scroll on the television screen after we are done. Please be safe, and thank you for joining us today.